welcome to Anatomical Gangster. This is the podcast where I work to challenge traditional paradigms and explore groundbreaking ideas in movement, self-care, well-being, even AI, technology, and environmental problems that we have going on today to benefit all of us so that we can learn, grow, and thrive in our bodies. I am your host, Sue Hitzman, and today I'm thrilled to welcome Dr. Robert Schleip. He's a leading expert in fascia research and a driving force behind the Fascia Research Society, which I am also a founding member of. And over the past 2 decades, the Fascia Research Society has been pivotal in advancing our understanding of this extraordinary tissue system organ called fascia. And our upcoming 7th International Fascia Research Congress promises to showcase cutting-edge discoveries and insights. Dr. Schleip is here to share his perspective and latest and greatest in fascia research and discuss some of the paradigm shifting science that is now shifting our understanding of fascia. We'll also talk about how the Fascia Research Society has evolved and what's next for this ever-growing field. But before we dive in, make sure that you subscribe to Anatomical Gangster wherever you listen to your podcast, and don't forget to leave a comment or question because your engagement helps us bring new people and new pioneers to the conversation that really matter most. Also, we will be talking about the Fascia Research Congress in New Orleans, which is August the 10th to the 14th. I will also be there hosting a 3-hour MELT immersion. So if any of you guys are curious about the methodology of MELT that I've spent the greater good of the last 25 years educating people worldwide on, this would be a great opportunity for you to come and experience MELT at the Congress. I'll also be speaking in the body of the Congress with Carol Davis about fascial unwinding, which I talked about in a previous podcast with Carol and, of course, John Barnes, one of the founders of fascial unwinding and fascial rebounding. I'll also be talking about one of our new products that's coming out this summer called the Fascia Hydrator, a low-frequency vibration tool to help you guys improve the fluid perfusion between fascia and lymph and help yourself feel better in a gentle, easy, and effective way. So I hope that you guys will join us August 10th to the 14th, and I also hope that you enjoy this great conversation with Dr. Robert Schleip. So, Robert, thanks so much for coming on Anatomical Gangster. I think this might be our 3rd time that you've been on the podcast, so thanks for coming back.
Thank you. I remember them very well, but I remember dozens of times that I don't tell the others.
Yes, indeed. I mean, we've had many, many conversations over the last 25 years, and you've been instrumental in so much of my work. So, of course, thank you. And we have this upcoming 7th International Fascia Research Congress in New Orleans. For those of you who don't know about this, it's August 10th to the 14th. It's going to be an incredible conference, I think the best one yet. And I'd love to ask you, how has the mission of the Fascia Research Congress evolved since its first Congress in 2007?
Now, the one in 2007 was a complete surprise to the 3, 4 organizers that I happen to be one of them, together with our common friend Tom Findley that we
Yes,
both miss dearly. So he
yes.
has, if there has been one person, but of course it was never one person, it was always a community event, but he would have stick out. And he had it very much to bring clinicians and scientists together in a high quality, academically oriented, but also clinically oriented dialogue. And the Harvard Congress in 2007 blew our mind. So there was a big explosion and it motivated many people. And
Yes.
then it continued to spread. And that has been happening up to this most recent Congress, where then, according to mismanagement planning on our side, I was damn sure it would be not a successful Congress, but now it looks like it will be the most dynamic and most successful and most alive Congress, maybe in the whole lineage.
I think so too, because this is the first time we were talking off camera that, Tom Findley, when he first said, hey, we need to create a Congress for fascia and get clinicians and researchers together. I remember Tom Myers kind of chuckling that scientists were going to share their unpublished research and like pilot studies and things like that, which you never really hear about in science. And they did, but it was always a tough call because there was never enough I don't think clinicians sharing their work with the researchers. It was just a
Mhm.
bunch of clinicians listening to complicated science that half of us were like, I'm not really sure I understood anything that that guy said, but it did sound important. And this year we have pre-conferences. I'm doing one. We've got Jill Miller there. We've got so many great presenters doing pre-cons and a lot of sessions in the body of the conference, these short
Yeah.
conversations about techniques, topics, and things like that. So I think that this is really, it's the first time where I really think the goal of clinicians and researchers together is really happening.
It's also how the pandemic has shifted the whole education business, where people get educational lectures often more efficiently in an online recording
Yeah.
because you can stop or you can rewind, you can look at the slides again. So many people have learned for academic information. You don't do as many conferences per year, and you substitute some of them with online learning. But for interaction between clinicians, show me what you do, how it feels. How do you call that? For horizontal, not for frontal communication, there a personal meeting is unbeatable. So I think that's also another reason why this conference is very different than the previous ones.
Yeah, I think it's going to be amazing. And I also know that there's going to be some really great highlights and themes for the upcoming Congress. Do you want to share a few of those that you're excited about?
So only from my perspective, yeah.
Yeah.
So I was instrumental in getting Stephen Porges as one of the keynote speakers, and he is very rare to get anymore. I mean, any psychosomatic conference organizing on emotional or on trauma therapies, they would be out of the moon to get him as a keynote speaker. But I knew he has been teaching for me here in Germany 20 years ago. I'm friends also with his wife, Sue Carter, who used to be the oxytocin researcher in the
Yeah.
world. So on pair bonding, she is one of the leaders worldwide. But also he used to be research director before Tom Findley for the Rolf Institute, long
Oh, no
time
kidding. I
ago.
did not know that.
Yeah, and for many decades, the research inspired by him, where John Cottingham was the first author and Stephen Porges was the senior last author, they were the most high quality research on structural integration and the autonomic nervous system. And
Wow.
then nothing substantial came afterwards. But now, in the last 5, 6 years, with Eric Jacobson, with our group, we have something similar. So he has a research background related to fascia oriented work.
Mm,
And that's
yeah.
how we got him. So he is a major highlight, also because so many people are now talking about the vagus nerve.
Yes,
It's a
and
healing
Gil's,
nerve. And
yes, and
anything,
Gil
yeah, yeah,
Gil's
yeah.
work with his
Gil,
nerve
yeah. So
tool,
I
I
want to
think,
bring
yeah,
Gil and Stephen Porges. They know each other,
yeah,
but he comes from an emotional, psychosomatic direction, evolutionary direction. Gil Hadley comes from a topographical tissue direction, and this will be a hot topic. And I'm very much looking forward also because there has been a big debate on questioning the theoretically evolutionary accuracy of Stephen Porges' model, whether the smart vagus is really a new mammalian development. And many people now question that. But there is no question about the clinical application of this concept. So that will be a very nice model, particularly as usually on this conference, it doesn't take more than an hour until somebody says who heals is right. If your hands have an improvement, what you do must be correct. And I would say yes, but your explanation may not be perfect, even if the outcome of what you do is perfect. And that will be a very nice conversation. I'm looking forward to get Stephen Porges together with some of the researchers who say no, the evolutionary sequence of the development of these different expression of the autonomic nervous system. Also, Katharina Fede, Carla Stecco, we
yeah,
did some very nice research on the sympathetic expression. So sympathetic innervation of fascia is the most richest sensory expression in fascia. So we
Mm.
showed, of course, many years ago, fascia is the richest sensory organ. We did a calculation with Carlo Stecco and a German scientist, but it's mostly the autonomic, it's mostly an emotionally oriented sensory organ, and proprioception is only a secondary emphasis of that.
Yeah,
So that is one of the highlights for me.
yeah, I've just recently on Anatomical Gangster had a podcast. I've done it twice now with John Barnes, who is the founder of Myofascial Release.
Mm,
And one of the topics that Carol and I are coming to the Fascia Research Congress talking about fascial unwinding. And the problem that I think we run into with fascia is that people take words literally, like they think that something they're doing is actually unwinding the fascia tissue, when
mm,
what John is saying is no, it's the energy that's stored in fascia that can often limit the expression of flow. It's all natural
yeah,
dynamics. And I said to him, you know, there's a lot of controversy with these sort of things because science and applications sometimes are very far away from one another. And
mm,
he said, well, fascial unwinding isn't a science, it's an art. And
mm,
it's and there is the fine divide of, do we need science to validate that something works? And I said to him, I think it's always great when you can bring science toward the clinicians so that they can better explain what they're doing on more of a scientific basis. Do you think that that is important to have science in hands-on therapeutic techniques, even if the result
yeah.
is the shit works? So
I,
where's the
I, I would
divide?
go further. So that's a big part. So you continue to do the same thing, but with less doubts about it. But the science doesn't help you to become more effective. You do that according to your everyday clinical application. That is one way. So you wouldn't need the science to be a good myofascial practitioner. That is one way. But I hope we are extending, and there is a brilliant example. The most successful pharmacological drug, aspirin, has been in the history of pharmacology the most successful one. That was based on Aristoteles and others describing the pain-killing effect of willow extract. And that was known before. But then they found out what element of the widow extract has that pain-killing function. And then they explained it is basically a cerebral, a central nervous system opioid administering function. And that explained the pain-killing. So far, so good. But then they found out that was a wrong assumption. There was a Nobel Award giving that it doesn't work in the central nervous system primarily, it works in the tissue unexpectedly. It's related to the prostaglandin and the inflammatory cascade. And that was
Interesting.
a big surprise. And then they were able to administer it more specifically. So the science changing the explanation made the clinicians be more effective. And then even more, now they use aspirin not for pain killing only, also as a heart medicine for
Yes,
different
yes,
functions. So
yes.
the science can question, but it can, if you are a clinician, you should read science, or you should have somebody who can read science and tell you your technique. Try it out at a different application than you used to think, or maybe do a bigger dosage, do less pressure, more pressure, not based on clinical observation, but on scientific laboratory research.
Yeah.
So I don't think science is not only giving evidence for what you already knew before and you can continue as you did before, you should interact.
Yes, what a great explanation of that. I fully agree. And for me, I think you know, I always want to do more research, and so we did like a pilot. I had told you
Mm,
after the last Congress, we took 150 people through the through the foot treatment for melt
yeah.
and improved flexibility. We improved range of motion and decreased back pain. And I
Mm,
said, now what we need to do is measure it with the indentometer and actually do a
yeah.
real pilot a clinical study. But I think that's it, is I'm always looking to dip my toes in and learn a little bit and then figure out how to create a scientific paper that in the end somebody's not going to be like, okay, yeah, but it's not good enough or whatever. And I think that
Yeah.
happens a lot. I think it's very daunting for clinicians to want to do research, especially with those of us that are not in a lab and have not
Yeah.
spent enough time
But
there.
that's why you need to go once a year to a conference, yeah,
Yes,
or
you
every
need to
three
get you
years.
excited. Yeah, get you
Because
excited.
you don't want to be in a lab. Now, I used to be with my clients for 30 years and
Yeah.
go into a lab once or twice a year. Now I live the opposite way. So I am every month I'm visiting some labs, and only once a month or twice a month I treat patients. But whenever I treat patients, I have the, oh yes, I know how it feels and how it is. So I will always be a manual therapist. But now I spend more time in the labs, and then I can go to a conference and communicate with hands-on therapists and,
Mhm.
and tell them, did you know, and try it out this way.
Well, and that's it, is you've done your own research, but you've helped so many young research come up and start formulating research. And
Yeah.
fascia research has really come a long way in recent years. What do you think has been the most paradigm shifting discovery in the field?
Of course, I'm more linked with my insights, probably, but that's already long ago for you. The discovery of the fascia sites by Carla Stecco. She
Yes,
should get a complimentary Nobel Award for sure.
I think so. And
And
she said to me, no, nobody really cared about it. And I'm like, how can that be? You
yeah,
discovered a new cell in a tissue that's
yeah.
providing hyaluronan. That sounds really important to me.
Yeah, and then also her brother, who has been in her shadow for good reasons for a long time,
Yeah.
and he does that in a very nice, adorable manner. How he is now together with others looking at the different hyaluronan binding. So the fasciicides, they produce it, but whether it becomes a sticky glue or whether
Mhm.
it becomes a slippery lubricant is done by other factors besides the fascia cells. And he is
Yes.
exploring how inflammatory cytokines, how mechanical friction, how endocannabinoids,
Mhm.
how shock wave therapy are influencing the viscosity of the hyaluronate. So certainly that is a new dimension, because in the past we were all looking at fibrosis, you know,
Right.
and collagen density, which is a big part, for example, in Dupuytren contracture or frozen shoulder or some cases of low back pain. But the slow changes that you get within minutes, that most likely is the ground substance,
Yeah,
and
the
then
fluid
it's the
perfusion.
fasciicides and the hyaluronan,
Yeah.
and not the sudden production of collagen type 1 or 3 fibers within
Amen.
3 minutes. That is unlikely.
Yeah, I always say, I mean, I've been talking about fluid flow since the beginning of time, and that's where
Yeah,
health
yeah,
got its name, right? It's not so
yeah,
much about collagen synthesis. It's also these instant changes are about fluid perfusion in regions where
yeah,
things are not moving, where fluid flow is unavailable to move. And why does that occur? I just feel like it occurs in spaces because spaces is sort of where fascia is extra durable. So it seems
yeah.
logical that we would get big changes there. But we were talking off camera about some new research that I've been following now since 2019 called AlphaFold. It's a huge breakthrough advancing protein science, and they've been able to um, follow protein unfolding and protein chains. So how
Yeah.
do you see tools like that influencing our understanding of fascia's protein composition and behavior? Do you think there's a link that they're going to discover something in
Oh,
fascia
sure. Yeah.
using
I mean,
AlphaFold?
just hyaluronan is a wonderful example. So it's the same chemical, but whether how it folds within itself, if it makes small knots or larger knots, changes the water binding and the viscosity, whether it's a sticky glue or lubricant. Is not made by the composition, but by the spatial orientation. And
Wow. Yeah.
this is type of protein, protein folding.
Yeah.
And I used to know a researcher. She was busy in the field where they worked for years to figure out what is the most likely spatial orientation of a certain protein, whether it does a 3 times spiral or eight
Right.
times spiral. And it
Right.
totally depends, it changes the behavior. But now with AI, they can test millions
Yeah.
of
Yes, I
different
was saying my
shapes.
my AI co-pilot is like
Yeah,
Tom Findlay on steroids. I mean, I
yeah,
actually
yeah,
asked Coco, what would Tom Findlay say? And he would come out with something
yeah,
that he believes Tom Findlay would say. I think that's
yeah.
so awesome.
Yeah.
Yeah.
So already this month, hyaluronan will be marketed in Europe, in the European Union, for
Wow.
low back pain. It's a
Wow.
Czech company, Conti Pro. I collaborated with them a year. They are doing the opposite of what Antonio,
And
but
wait,
with
so you mean an injectable?
yeah. So in cases of low back pain, and we can do some ultrasound before, how likely do you have fascial low back pain? Where fascia is one or major contributor to the low back pain. Sometimes it's only in your brain, sometimes it's only in your
Right.
lumbar discs, but that's not the majority. But at least in a significant portion, it may be 30%, maybe 50 or more, fascia is a main causal contributor to the low back pain.
Yes, indeed.
And then they inject hyaluronan at a certain protein folding small composition where
Mm,
it's a lubricant.
wow.
Because the research by
Right.
Helen
Flag.
Laurgever and others has shown you have a reduced sliding mobility, so you have a more viscous ground substance in low back pain patients. So Antonio's approach is to inject hyaluronidase, an enzyme that breaks down
Breaks
the
it down.
sticky hyaluronan,
Mhm.
and that may be ultimately more powerful, but his company is not yet ready. The Czech company is now pioneering this month, and they don't break down the sticky one. They inject more slippery hyaluronan, and they have done animal research, but also human research, where they injected the slippery hyaluronan with a specific protein folding
Mm,
that they didn't do with AI, they did it with experimental trial and error. So they tested the different hyaluronan bindings in rabbits and found out where do you have the most slipperiness and where does the body accept it for the longest time before it's eaten up.
interesting.
And they did a comparison with placebo injection compared with this new substance, and there was a clear improvement in low back pain. So that
Wow.
is one development, but it took them years. Now,
Yeah.
if you can use AI to make the slippery hyaluronan even more functional, this is only one example.
Yes, my a friend of mine has written a book called Some Future Day, and it's how AI is going to change everything. And I really do think that there's so much we will discover about ourselves because AI is available to us now in these new ways. I think
Yeah.
it's huge. And I know that even with some of the work that you had done about depression, and we had talked about how you'd think, oh, the fascia is going to be more stiff, but then it's like actually it has more of a dampened effect. And I said, yeah, it's kind of like a sponge that you've overused too many times, and it is kind of like soggy in its own right. Yeah.
Soggy, yeah, yeah, yeah.
And it's such a great visual for people, but I think that it is important to know that the research I think that has come about in the past decade is really changing not just how we view movement, but how we view emotions, because a lot of people will say that we hold memory in our fascia. And so now the question is, do we have science to validate that concept? Do you think
Mm.
that fascia is a parking place for past emotions, or is it a relationship between the nervous system and how autonomic regulation? I think some people are just, oh, their sympathetic state is on, and they can't self regulate. And because of that, their fascial tissues react. Or do you think it's the other way around, that fascia is adapting and that can cause an emotional effect? Which way is it?
I have good evidence for both directions.
Mm.
So the research that I also will be presenting here from Germany is the epimysium of the trapezius is not only stiffer altogether with the muscle underneath, that was shown before, but now they also showed with high resolution ultrasound. So high resolution ultrasound may be the number two new development for fascia research besides the hyaluronan and because ultrasound can measure now tens of millimeters. And
Wow.
that's what you need because the epimysium, that means the fascial envelope, not on the inside, but on the outside of a muscle, is usually only like 1 millimeter or less. So if it's 30% thicker, you can palpate it, but you could not measure it with
Mm.
any ultrasound. But now you can measure it. And with that high resolution that now ultrasound has, which was not around at the time of Moshe Feldenkrais and Ida Rolf, they would have loved to use it. They
Oh, sure.
showed that the epimysium is stiffer and thicker in
Mm.
these people. And that has similarity with delayed onset muscle soreness after eccentric heavy exercise. People have sore muscles. And it used to be believed it's micro injury and the set discs of the sarcomeres, and then it's the fluid edema swelling inside of the muscle. But Jan Wilke and others, they will present their research in New Orleans. They showed it's the
DOS.
epimysium
Yeah,
which is
DOS. I love it.
swollen and also
Yes.
thicker. And if that swelling happens in delayed onset muscle soreness, not in depression, there we don't know,
Mm.
within 2 days,
Mm.
then it must be a fluid increase because in 2 days you are not growing new collagen fibers. So
Right.
it's an edema. It's the liquid that you have addressed that is definitely responsible in the thickening and hardening of, you could call it body armor, in
Mhm.
the delayed fascial onset muscle and delayed onset fascial soreness. People are discussing to
I like
change
it,
the
DOS.
name.
I like that
DOFS,
idea.
yeah, yeah,
DOS.
yeah.
Yes. I
But
love it.
also in depression, it could be similar. It could be a body armoring where you have a fluid hardening on the surface, not so much inside of the muscles. And that is a new discovery. But
Yeah.
also, if you have a change in the stiffness, if you become less mobile. So I just had a long talk this morning where we are evaluating a research study, and the mobility in terms of neck flexion mobility is limited, correlated with the stiffness that they have in their trapezius, which is not surprising.
Hmm.
But when you have a contracture of your movement mobility, it reflects on your psychological dimension. And that
Wow.
is also a new,
Yeah.
I mean, there has been, Amy Cuddy's research,
Yes.
when you are in a power pose, you are more happy. She was partially wrong. She started a whole revolution in science where they showed her research is not replicable because she didn't use, according to Tom Findley's details, where you question everything in your own research. So when they replicated her research, half of it was not replicable, the stuff about testosterone and etc. So that started a big crisis. You cannot do research anymore as you did it before, Amy Cuddy, and every psychologist is warned. Please, no, don't follow Amy Cuddy. You need to be more anal. You need to
Yeah.
do more countermeasures.
Yes.
You need to register the parameters that you want to select before you select them. You don't do cherry picking as she did, etc.
Wow. Yeah.
And
I mean,
but now we have a new meta study by Professor Michalak, who I'm representing with. He cannot come, and he looked: is there a relationship between postural things and emotional things? And he said yes. And it's a meta study of more than 60 individual studies, all of them better than Amy Cuddy's study,
wow.
not hormonally, but emotionally. However, the relationship between posture and emotions is more severe in contracted postures than in open postures. And that's not what I would have expected. As a therapist, I used to spend more than 50% of exploration and self observation time to have the client notice how their emotions change when they sit upright. But now, according to that new meta study, I do it the opposite. The connection between mind and body works much more potent when you're in a contracted posture. So
Interesting.
you do micro contractions and see how your eyes change, how
Mm.
your breathing changes, and then you go back to neutral. So this is a new research. Yes, the tissue condition, particularly if you go into contracture, has a strong potent side effect on your emotions. So this is definitely working, particularly in stiff postures, not so much. So if you go in an open posture, it may influence your emotions, but maybe only superficially.
Mm.
But if you go for 3 minutes in a contracted posture, it will stick for you for 3 months.
Wow, that's powerful. And
Yeah,
you're saying, I mean, there's so many things because we're talking about, we know fascia plays a role in movement. We are now looking at fascia's role on emotional
yeah.
constitution. But do you think that fascia plays a central role in longevity, and could understanding its adaptations with age open doors to new health inventions or interventions?
Oh, sure. Yeah, definitely. Then it's not only fascia, but the stiffness that comes with old age, but also, I mean, the major effects, the main cause that shortens our life are cardiovascular disease. They kill more life years than all the cancers together. But if you do cancer and cardiovascular pathology, stroke and heart attack together, that is at least two-thirds of what shortens prematurely people's life.
Gotcha.
And
And what do you think might be the latest advancements? Because regenerative medicine is like, all
yeah,
the rage now, and tissue
yeah,
engineering.
yeah,
How do you see it intersecting with fascia research and, again, potentially leading to innovative therapies or applications?
yeah. So if cardiovascular disease is the life year killer number one, then you want to know how you can lower arterial stiffness, arterial sclerosis, because almost always it goes together with a hardening of the artery walls as
Yeah.
you age. And the more that happens, the more rapidly it happens, the more likely you will get a heart attack or a stroke. And they showed, you'll probably love this, but you haven't known it before. People who regularly stretch, they have softer arterial stiffness in their walls.
Hmm,
And
I'm not surprised on that. That
yeah,
sounds.
so people will do fascial stretching, and we then can discuss what directions, more oriented on the neurovascular bundles than on the muscular. You do stretching not in order to be more mobile and to put on your socks without external help. No, you want to have more smooth, and it's probably the nitric oxide. They thought it's the autonomic nervous system. If you do slow stretching, you would be more vagotone and less sympathetic. But that seems not the main explanation for this very unexpected potent effect. It seems to be the nitric oxide, which is a gaseous transmitter. Of
Yeah.
course, you can produce it by chanting, by humming,
Hmm.
by not breathing through your mouth. So also by meditation and by foam rolling, you produce nitric oxide. But regular stretching seems to be the Viagra. Viagra made millions of increasing, of softening the blood vessels in one particularly male body part. But if you do regular fascial stretching, it would be like a Viagra for the whole body.
Yeah.
And
It
then you
sounds
have
like it.
Helen Lajeva's research also coming in that certain stretches, more the gentle stretches that last longer, they have an anti-inflammatory effect.
Yeah,
And
that makes sense.
then you go into longevity, not only because of the cardiovascular effect, but also the silent inflammation that we all suffer as we get older. It makes us much more prone for the maturity of cancer.
Yeah, and I mean, I always say with aging and everything, I'd like to buy a vowel and pass my turn. I just don't even like the idea of it. And now that
Yeah.
I'm going to be 55 this year, and I just think, God,
Woo!
it's like you're 30, and then suddenly you're an AARP member, thinking, what happened to my youth, and how is that possible? And I was talking to my mom, who's going to be 85 this year, and I said, isn't it shocking? Your body and your mind and your spirit and soul have been around on this planet as a human being for 85 years. She goes,
Yeah.
I don't know what I've been doing with them all. And I said, well, you should sit there and think about that. So, I
Yeah,
mean,
you
it's,
have to come to the next winter school in Padua,
yeah,
because they similar like for sure we will have it in New Orleans. They have the wildest, most useful dancing parties there.
yeah, I
You know,
can't wait
all
to see
these
it.
old rock and rollers are coming, and
I
I
love
can
it.
see you jumping up and down.
I am
So,
sure I
so
would.
to answer your question, if fascia research or fascia as a topic of attention can make people have an anti-aging effect, come to the Saturday night party or whenever
Yes.
it happens in New Orleans, and you will see an answer.
Yeah. I mean, I'm telling you, I think that's I think one of the biggest joys is reconnecting with all of these pioneers who
Mm,
have really been at the helm, like you, with the Fascia
mm,
Research Society. And, I think about that. You've been doing this for 40 years of your life in
mm,
rolfing and body work. So, how has your personal understanding of fascia changed throughout your career because of your hand in so much research and also working with some of these new brilliant minds who are coming up with new theories and new research and the forefront of fascial research?
I get more and more humble. So
Right.
last night I slept on my terrace again, and I'm so happy if I look at the vast sky,
Mm,
the Milky Way, and how unimportant little Robert is. It's
yeah.
ridiculous.
Yeah.
And
It really is, right?
and the more you open, the more you realize how vast everything in that field is. And that has been my development. Of course, you have heard that um, slogan many times from Tom Findley: the more you study, the more you know how little you know. I've
Yes.
known it, but if you feel it, so now there is almost nothing I'm excluding that may come up at the next conference. I
Yeah.
used to be thinking the best thing you can do for fascial health would be hopping and swinging and dancing, and I have lots to support it. But now we have Keith Spa and Michael Kier coming, and they point to elastic recoil, but
Mhm.
they do tendon training in a isometric fashion.
Yeah.
And that used to be most unfascia oriented. The
Interesting.
astronaut exercises where you hold for 10 seconds and then you relax. But they show for certain functions, for tendon regeneration, it is more potent than my elastic bouncing that we had there. So this is just an example. So I'm less sure on anything. I think everything is possible and it's
Well,
very
yeah. I mean, you
exciting.
close your eyes and like I always think to myself, if you look out and you think of how vast the universe is and how little we know, but also just how you said how tiny
Yeah.
human is, and everybody who feels like they need their significance and my
Yeah.
legacy and the this and the that. I think, yeah, as you get older you realize I am just doing my tiny little bit to offer goodness in the world and to try to have peace in myself and offer that to everyone else. I think that it's very humbling when I mean, I spend a lot of hours of my free time reading research, reading books, and learning from brilliant minds, and thinking to myself, there just is not enough time to learn it all. I just will
Yeah.
never have the answer of like what really is the meaning of life. And I just believe it's love. That's just got to be the answer, is that the Beatles had it right. Love is all we need. We just need to love one another more. And our fascia
Let's
would be
finish
better.
there.
That's it. If we loved one another more, our fascia would be perfect. We would hold no
Yeah.
trauma in our body at all, and we
Yeah.
would just be
But
flowing.
it makes the dialogue. So I'm having now more fun. I used to go to these conferences with some guardedness and some, I need to admit, arrogance, because they are usually some missionaries who follow you through the. Are you Dr. Schleip? I've
Yeah.
been waiting for you for 20 years. I need to show you my. Are you willing to lie on my treatment table? And I would send rescue signals to my. Please rescue me because I will not get out without argument here.
Yeah.
And then they have developed some kind of tool, or they have found the solution of all humanity problems by pushing three buttons based on my eye color or something like that. And so you see, so you can see my arrogance. And I usually say,
I
give,
mean, you
give
hear a lot of craziness out there.
yeah,
There are
yeah,
all
yeah,
kinds of
very,
ideas where,
yeah, yeah.
I've got a bruise every square inch of my
Yeah,
body,
and
or
and
I've got a
I
this
found
or
the
that.
monocausal explanation of
Yeah.
everything.
Yeah.
So
There's
if you have
always,
blue eyes, I push
yeah.
here, and then I
Yeah.
do this test here, and
Yeah.
then there will be no more any of problems. You will live 200 years in the world.
Yes,
There will be
breath
no
work.
wars,
There's
and
all
people
these
will
new,
love each other.
yes, all these new techniques, all these new breath work techniques. I'm like, we've
Yeah,
been breathing since the beginning of time, and none of this is new, by the way, people. This
yeah,
stuff, if you look at the Vedanta, you look at ancient writing, they were talking about this. I think we
yeah,
just kind of forget that all of these pioneers and
yeah,
soldiers who were out there, like Ida Rolf. I mean, I'm
yeah,
so grateful that we are honoring her work at the Congress. I think that this is also something very exciting because I
yeah.
think she really was a disruptor, and much like Moishi Feldenkrais was speaking something that was so in her that this was her message to people. And it's amazing how many people have carried on the legacy of her and how much Rolfing has transformed, I think, over the years. It's
Yeah, yeah.
impressive.
So I've become less arrogant. So the missionaries who will be there in New Orleans, I will know. Why not? They could have a good point,
Yeah,
And
we just
pushing
don't
these
know.
three buttons may be the solution to all of
Maybe. Keep your
humanity's
mind open.
problems.
If there's three places on my body I can touch and I'll be one with the universe, I'll touch myself anywhere. I
Yeah,
agree.
so I'm now less sure about my arrogance,
Yeah.
and some of the weird ideas may have actually a lot of meaning. And what you
Yeah.
said about Ida Rolf, I'm really looking forward, because that's probably also the reason why we got Stephen Porges,
Yeah.
because he was one of the early scientists who recognized her potential, and against her own emphasis, linked it more with the autonomic nervous system than with the somatic nervous system. And that
It,
was a big difference to Moshe Feldenkrais.
is that where you think the future of fascia research is
Yeah.
headed? Is really with the advancements of linking fascia and the autonomic nervous system and regulation?
I just did a webinar for a French osteopathic organization on adolescent idiopathic scoliosis.
Mm,
And there, the key is more on the proprioception, not the only key, but linked with the Nobel Prize discovery on PSO2 receptors. They found out that many of these scoliotic girls have a genetic variation where they have smaller muscle spindles, and their
interesting.
proprioception
Interesting.
based in these muscle spindles, which are in the fascial perimuseum, have a slower signal, a more inaccurate signaling precision. So
Wow.
that would be not autonomic nervous system, it would be
Yeah.
the proprioceptive one.
Proprioceptive.
But
Wow.
I think the majority of myofascial pathologies are autonomically linked, not only associated that the autonomic innervation is much, much richer than the proprioceptive one. It seems to be a major factor, and that's particularly true outside of the dense fascia, in
Hmm.
Gil-Hadley's fuzz or fat layer. So
Yes.
that seems to be where most of the pathological interaction happens, not only in the depressive people, but in even low back pain, etc. It happens outside of the fascia profunda. That's mostly where the lymph drainage is affected and where the autonomic nervous system, also in the beneficial healing effect of your hands. So as
Hmm.
a rolfer, I don't need to plow in to go deeper than my colleagues, it may be sufficient to stay in the upper 2 centimeters.
Yeah, I think that's also what Melt and everything I've worked on for so many years was Gil really changed my
Yeah,
mind about looking at the superficial fascia more deeply and what gentle approach could you
yeah,
induce. And again, with this new fascia hydrator, working on the superficial tissue to try
yeah,
to help for the lymphatic return. I think that it is quite powerful. I've noticed great
yeah.
changes in myself. So again, I'm excited to bring these things to the Congress this.
So hopefully AI will enable us to get a technological step like we had in ultrasound to measure lymph drainage more specifically and more accurately. We don't have a tool
Yeah.
that is as reliable that you do a stroke and you measure the lymph drainage in the different layers. We don't
And there
have
you're
that.
saying there is or we don't have it?
We don't have it.
Yeah, so
Yeah,
that might be a new thing, and
yeah,
I look forward to that because I definitely think that where Christopher Gordon's work has gone is a need to link that understanding of the fluid between the fascia and lymph
yeah,
and this connection between the two. I think it's a huge kind
yeah,
of a missing piece. And I'd also be curious, because you talked about recent studies and discoveries in fascia research that you think could fundamentally alter the way clinicians approach treatment. But
yeah.
what challenges does the field of fascia research currently face, and how do you see them being addressed in the coming years?
Well, one debate will be about the vagus therapies. It may be less stimulating specifically the right area of the skin where the vagus, for example, inside the ear, we have a square centimeter, and people thought you need to be very precise to stimulate the vagus rather than the facial nerve or the trigeminal nerve, because the vagus is a healing nerve and the trigeminal nerve is the opposite, etc. But now this new debate that first of all, in the face, all the facial nerves are very much intertwined. So you never just activate one.
Yeah,
Only electrically you can do that.
yeah,
But whenever you do mechanical intervention, you stimulate the whole family. And then it's not the particular emphasis on the vagus, it's the sense of coziness, of
mhm,
social safety. So it may be that Stephen Porges' secondary principle of what he calls neuroception, that healing needs to have the perception of the client that you are in a warm, cozy safety connection, is the main healing effect, and then you could just stroke the skin here. If the client feels safe, that may be more potent than if you do a so-called vagus stimulation
absolutely,
on the right tissue stimulation for that.
absolutely, absolutely.
And then you would
That's trust, right?
train much
Trust.
more. Yeah.
Yeah.
So in your training, you would record the warmth of your voice, how
Mhm,
long you pause before you ask the next question,
mhm,
what temperature of your fingers. So, for example, 37 degrees is too uncomfortably warm for some clients.
mhm.
30 degrees is too slow. 35 degrees for most people is what gives them the right sense of what Stephen Porges calls neuroception. So we need to reorient what is important and what is not oriented important.
Yeah, and these are so important. I mean, because first of all, every human body is different. Every client is different, but really meeting them where they're at with your
Yeah,
energy, with that sense of calm. I know for my mom, I've been treating her quite a bit because she has a severe anxiety and she will just be in such a state. And I just put her down on the table and she's so like this. But the second we just breathe
yeah,
together, you just see her whole body soften and relax, and then things change and she gets up and the next day
yeah.
she has so much more calm energy about her. And I just always think it's so profound to just not feel like you have to fix anything in a body, but you can just be with them, and that right there is healing in and of itself.
Yeah, so that's where the clinician can learn from the scientist. Like in the aspirin, we used to think it's the pain-killing effect of the central nervous system,
Mhm.
and now we know no, the shift happens in the tissue and it's related to inflammation. And then you can use the same drug more potently than before.
So
So
is that how you think practitioners and therapists can best
yeah,
integrate the latest
yeah.
fascia research into their
So
work?
you come back from New Orleans and you may do the same thing, but you are less nervous about placement of your finger, but
Yeah.
you take more attention of the body temperature, of the safety in the room, whether the door is closed or open, what kind of pictures you have.
Yeah.
So on the perceived safety, not on the objective safety from your perspective, but whether the client feels safe and connected with you. And you know that is the main important effect. And whether you get the vagus nerve or the facial nerve or the
That's right.
trigeminal nerve may be
Yeah.
secondary. And you didn't know that before the conference.
Yeah, that's for sure. I think that really it is going to be such an incredible time. I'm so looking forward to seeing everybody as well as you at the Congress this year. And Robert, I ask everybody on Anatomical Gangster the same question as we're coming to an end here. So I mean, I'm so jazzed out about everything that you said, but I'm going to throw this one out to you and see what you have to say, because this is just a life question. If you could tell somebody something that you've learned that has completely changed your perspective about life, about love, about the human experience, and you think if somebody else heard what you've learned, it might very well change the course of their life, what would it be?
It's an advice I got from two people when I seriously considered changing career prior to the age of 50, whether I want to become a professional scientist rather than a manual therapist.
Mm.
And I interviewed some people, what what advice you can give me. And Franz Mechner was one of them. The other one was Achut Zorn. And they said, question your most sacred assumptions, those that you don't want to question, and then you will be a better scientist. So those convictions that you are most evangelic about, once a while stop and say, are you a dog barking up the wrong tree? You know, the problem may be somewhere else. And if you are always attacking here, we need to get fascia less stiff or whatever it is. So this is a very humbling, it's not an enthusiastic wisdom, but it has helped me and protected me in many ways. And I look for the same kind of questioning mind also in my research fellows. And that's what I like to nurture with each other. So those assumptions that you feel most emotionally convicted about, please nurture a question mark. And that helped me a lot.
Yes, indeed. I think, yes, question everything and only believe some things. And the things
Yeah.
you believe, open your mind to other ideas, because there's probably more to
And
uncover.
then you become like little Robert under the stars, and somebody shows you the Milky Way. You know, it's
It's true. It's
yeah,
true. We can learn a lot from the universe about our human body and our human experience. And I think the other way around, I think that people who study the universe could learn a lot about it if we
yeah,
look a little more
yeah.
deeply with us. It's the
But
same.
then you need to be silent and hold somebody's hand, you
Yeah.
know,
Yes.
when that magic happens. And that
Yes.
I had that in every conference, you know, Tom
Yeah.
Findlay reaching over and squeezing my hand.
Yes, indeed. I remember that when I saw Dr. J.C. Gumberto strolling under the skin with Gil, and he
Oh,
held my hand, and I literally was sobbing, saying, "That's the thing. That's it. That's the fluid. That's the adaptability." And he's like,
yeah.
"Yeah, that's it. It should confirm what your belief is, and ground yourself and sit with that and see what comes up." And then I wrote the book. And I think I have so much of Gumberto's heart in me, and we're actually helping him to launch his new 12 conference collection out to the US market, because once again, all these great pioneers, and they have trouble with marketing. And I'm like, well, maybe we could help you market it, because I feel like we have a good
Yeah,
ability to reach people.
yeah.
So maybe we could reach more people for you. So I'm
And
excited
you
to launch
inspire
that.
other people
Yeah.
to think like Jill Miller, like Gil Hadley, like many others.
Yeah.
What can I contribute in my network
Yeah.
to get the message more out? And that is very infectious.
Yeah. Yeah. Well, Robert, it's so great just to chat with you. I could talk to you for hours, and I just
Don't,
cannot
don't.
wait to soak in all of the science that is to come at the Fascia Congress. And again, for those of you guys listening, I hope that you will consider joining us. Even if you're not a clinician or a researcher, I think that if you really have a curiosity about the human body, coming to the 7th International Fascia Research Congress in New Orleans, again, it's August 10th to the 14th. This is a huge mission, and so many great pioneers will be there. So I hope that you will join us. And Robert, I look forward to seeing you and everybody who's listening. Thanks again for being part of the conversation. Make sure that you leave a comment, share this one with your friends, and of course, stay curious, stay gangster. We'll see you next time.
Woo!
I love